Hi, my name is Lily Schaefer, and this is my presentation over diversity and family factors related to autism spectrum disorder. So our objectives that we're going to go over today is identifying and defining various diversity and family factors. We'll specifically be hitting the topics of bilingual families, race, and socioeconomic status. We'll discuss how diversity and family factors relate to ASD, and we'll provide evidence-based guidelines to use when working with families. Move me over here. So, autism spectrum disorder. Here's a quick refresher. ASD refers to a disorder currently diagnosed through symptoms which involve difficulties in social interaction, verbal and nonverbal communication, and repetitive behaviors. In the picture over here on the right, we can see that 1 out of 36 people have autism. Males are diagnosed 4 times more frequently than females. 50% of learners elope. 40% are nonverbal. 8 times are more likely to have tummy issues. Over 50% have chronic sleep disorders, and 1/3% of the population has seizures. So, concept of cultural competency or competence. The definition is involving understanding and appropriately responding to the combination of cultural variables and the range of dimensions and diversity that the professional and client bring to interaction. This definition is extremely important to understand because it involves both the professional and the client. As professionals, we need to understand our own culture as well. Having cultural competence will allow you to have better interactions with the parents, caregivers, and the client. We must recognize all the biases we have in order to build professionalism with diverse families to create a clinical community that values respect and collaboration. Having cultural competence just equals better relationships with families. All right, so this picture is just kind of a graph of cultural competency. It starts with cultural disruptiveness, which is kind of the extreme, and then it goes all the way to having cultural proficiency. The end goal is to have cultural proficiency, and you might not always start right at cultural disruptiveness, but this is just kind of a guideline, as where you can kind of be at. As you can see, developing cultural competency is an ongoing journey. The goal is to treat all learners and families equitably, meaning a fair and reasonable way that gives equal treatment. Okay, now going on to our first little section, race. Excuse me. ASD affects people of all races, but research shows that Latinx and African American children are diagnosed with autism at a later age than white children. Unfortunately, these kids receive fewer treatments, like ABA therapy, OT, and speech, in comparison to white children. It is important to know that minorities are also less likely to have insurance and fewer services offered by Medicaid providers. A study that was done in 2001 by McGill University in Montreal found that doctors were more hesitant to diagnose a child with autism if they were a minority. Specifically with Black families, doctors associated bad behavior as the child just acting out rather than them giving them an autism diagnosis. Many minorities feel like they are not being listened to when speaking to healthcare professionals. So here are some recommendations that I have and have researched when working with families and children that are a different race. Practice pre-cultural competence. Make sure you are actively trying to seek out knowledge about the family's background. You can do this by just talking with them and learning from them and researching on your own. And then also for yourself to practice pre-competence, you can complete online quizzes to evaluate your own. As always, be respectful when talking with families. Make sure you're listening and try to have empathy for their situation. And prioritize gaining trust with the families while educating and informing them on the client's needs. Ooh. On to bilingual families. I'm going to move me over here on this picture. In the United States, more than 12 million children speak a language other than English at home, which was really awesome. This means, though, about one-fourth of the ASD population are bilingual. Many parents feel that they should restrict language exposure to only one language because children with ASD already present communication skill deficits that affect language development. By doing that, the child is not fully integrated with their community, and family relationships may not be as strong. Another struggle for bilingual families is coordination of care. Many healthcare providers and teachers only speak English. This makes it especially challenging for bilingual families that cannot communicate their wants and needs for the child. Um, it may be difficult for non English speakers to find available resources. For example, a family looking for ABA services may not know where to apply or how to fill out the required forms needed to get that service. So, my recommendations that I have found, the easiest one, if it's at all possible, it would be easiest and most convenient to get an interpreter with you during meetings. This would allow you to give information regarding services, and you can answer any questions that the family might have. Obviously, that might not be the most easiest thing to get, and that would be the most ideal situation, but that's it's not going to happen all the time, which really sucks. But there are several things that you can do, like just researching for that family. um, you can look up websites that can provide parents with information relating to ASD and services that they can get. Behavior 360 Behavior Health can translate forms and documents from English to Spanish. But in the end, acknowledge that the parents are strong and remind them that they are doing the right thing by trying to help their child. Try to make them feel comfortable talking to you and make meetings a safe space with no judgment. Okay, socioeconomic status. Um, Recently, people in the field have realized that there's a relationship between socioeconomic status and autism spectrum disorder. Studies in the United States have found lower rates of autism diagnosis associated with lower socioeconomic status. This means that these children are starting services at an older age, receiving fewer treatment hours, and are just being plain out misdiagnosed. Low-income minority individuals with ASD are at higher risk of potential negative interactions with the law enforcement. Factors that may place an individual at increased risk of criminal offense can be poor education and late diagnosis. There is even evidence that shows that after being incarcerated, then after they go to jail, the person is then later diagnosed with autism. So, some recommendations. First and foremost, it's important to know that if a learner comes from a high or low socioeconomic background, they still deserve a proper ASD diagnosis, the correct type of service, and the proper amount of treatment hours. Realize that children growing up with low socioeconomic families are being diagnosed with ASD at lower rates because their caregivers do not have access to healthcare providers that should make the diagnosis and give them support. One of the best things we can do is advocate for these families. We need to make others aware that these families struggle and help dismantle systems that prevent equitable access to care. Specifically for low-income minorities, it may be beneficial to directly address um, expect. Sorry, they might be Specifically for low-income minorities, it may be beneficial to directly address expectation behaviors when dealing with law enforcement. If you disclose with an officer that you have an autism diagnosis, they might be more sensitive to certain situations. All right. Closing thoughts. Just make sure that you have self-knowledge, know what your culture is, get other knowledge. What are other cultures? How do other cultures define ASD? And use your knowledge to practice. Learn to appropriately shift clinical interaction skills to bridge cultural differences in understanding autism diagnosis and treatments. And listen and do your best to understand. Let caregivers feel heard and accepted and treat others equitably.